Aloha, everyone at home. My name is Patty, and I'm one of the managers here at Pacific Media Group. There has clearly been a need to share stories and information here on Maui. We all have so many questions, and we're eager to get more information, so I'm volunteering to jump in to provide some videos and organize information for you. Hopefully, this will help give you some great insights and information while we all get through this crisis together. Which brings me to today's topic. In regards to COVID-19, I have heard so many people say, South Korea did it right, which is interesting because before I was even concerned about coronavirus and its obvious large-scale implications, I was planning a trip to South Korea to visit my mother and sister who live over there. We got on a video chat to discuss the vacation, and the conversation quickly turned to coronavirus. This was on March 8th, so of course I had heard of it and that places like China and South Korea were dealing with it, but I didn't quite understand at that time the scale of the problem. In speaking with my sister, she shared with me that the virus had spread quickly, that everyone began working from home, that those who were older were not able to leave their house, like my mother, and that gatherings like schools and churches and those types of things had all been closed. Saying it now, it seems pretty obvious, but I remember being a little bit surprised with how extreme it had become. I remember saying, I don't know if it's going to be safe to visit there. And her saying back, it'll be good here by October, I'm sure, but it may be worse in the US because you guys aren't testing. And we're seeing some of the implications of that lack of testing now in places like Italy and in the US. And before we go any further, I want to introduce you all to my sister who is joining me from Korea. Her name is Bo Sun, and she is the managing director of the Motion Picture Association in Korea. And to be clear, she is not an expert on COVID-19. She's just someone who has lived through the ramifications of the pandemic and here to share some of her experiences.
Hi, Patty.
So good to see you. Thank you for joining us.
Thank you for
It looks like
having
your
me.
work in Seoul. Is that right?
Yes, that's correct.
Okay, everybody, it was Bo's birthday just the other day, so big happy birthday to Bo. Thank you for taking your time. Really, really appreciate it. Obviously, you're in South Korea, so not only are you in the future, literally, because it's what, 16-hour time change? I don't know.
I don't know
lot.
either.
So she's literally in the future, but also you guys have gone through some of this COVID-19 crisis and, seen how that all played out, and just kind of interested in getting some of your insights. So could you just sort of give us an idea, when was the first case or first big cases that you started to see the spread in Korea?
Okay. But first, I just want to say I'm in no means an expert on this thing. I'm just sharing my experiences being gone through it for the last 3 months.
Yeah.
So our first case, I believe, came in on the 19th of January from overseas.
Okay.
And then the spread actually started happening sometime in early February with the patient that we number, I can't remember if it was 31 or 34, who came from a certain religious group called Shincheonji. And then they realized that from this religious group that a mass infection can happen.
I see. And so I, in a little bit of research that I had done prior to, was under the impression that Korea actually did testing across the board with everyone. But having done that research, I actually came across some information that said maybe no, they found the source, and it was actually that religious group, and that they sort of just isolated and tested that whole group and quarantined them. Is that the way that played out?
Yes. So it would absolutely make no sense to test 60 million people at one time. So what they did was whoever was in the high risk area, they were testing first, especially the Sincheonji, because they realized that a lot of the cases were coming out of this church group. Then if anybody was traveling in from China or from any other high-risk countries, they were testing first. And if you were showing symptoms like high fever, coughing, sore throat, all that, then they would go through testing. So if it was me as a healthy person just walked in and said, I'm so worried, I want to get tested, they say no. Just
Okay.
go home.
Well, that makes a lot of sense. I know here we've had a little bit of a trouble with not having enough tests. Like we've had a lot of people who've said, I show all the symptoms, but I still don't qualify for the test. I don't meet the criteria. So I think more tests are being developed, more tests are going out to the public. And so we should be seeing different numbers happening pretty rapidly here as those kind of get passed out. But one of the things that I know you had mentioned actually about the church was that they were closing down most of the churches and schools and things like that in Korea. Isn't that right?
Yes. So because they realized that it can be a mass infection from these kind of group gatherings, they closed down schools since January. Probably they haven't said exactly when it will open again, but they have sorted to online classes now. So teachers are giving online classes to their students. And churches, because the government has done a social distancing, I guess you can call it rule. So they're telling churches to please do an online service instead of doing an offline meetings because there's always a high risk. And they're asking people to we haven't closed down, what do you call them? Restaurants or meeting places or any of that.
That's
just that
interesting.
they're asking people to just take care, be smart about it. If you go out, please don't meet more than 5 people. When you go out, make sure you wear a mask. Always wash your hands when you come back, and try to distance yourself from at least 2 meters from each other.
Okay, so do you think these are some of the precautions that kept Korea maybe ahead of the curve as far as getting rid of, or the vast majority of the cases, or slowing down, flattening the curve?
Yes. So basically, Koreans are used to wearing these masks because our air quality is so bad. We have this fine dust problem. We have a yellow sand problem that's coming in from China. I believe the Gobi Desert. And also, so people in Korea if you wear a mask, they're not really looked at. It's like, oh yeah, another person wearing a mask. It's a norm.
Yeah.
And also, it also helped that we went through the MERS crisis. We went through the SARS. And people actually are very highly aware of all these diseases and how much mask and washing your hand actually really helps.
That's really interesting because it seems like you guys were already sort of prepared in that way. Like here, I know there's tons of companies that are actually stopping production and creating masks right now because we have such a shortage of things like masks and respirators in our hospitals. So very interesting that, it's such a commonplace thing in Korea. You guys already have the mask. You're ready to go. Just pop it on, go out, and you're good to go. So, interesting.
Right.
So, on an entirely different note, what are the people in South Korea doing, or what have they been doing over the course of these 3 months while you guys have been dealing with the crisis?
Well, let's see. Because they haven't really mandated everybody to get quarantined, people actually do go out. Nowadays, even though we have a social distancing, people do go out to enjoy the spring. We have all these flowers in bloom now. It's so pretty. But of course, they're going out, I'm going to say it again, masks and hand sanitizers on hand. And we actually do have people coming up from local governments with hand sanitizers. So people who are passing by, they would just spray their hands so they can sanitize their hand. If there is a place where, when the flowers are all in bloom, people will come and they will, so you never know. So everybody's taking precautions. And the other thing is, unlike the US, our entertainment productions have been stopped. And with the popularity of the K-dramas and whatnot,
Oh, yes, we all
we're
know.
still, yeah, we're still producing dramas.
Nice.
So on
Good.
the entertainment front, other than the movie theaters and the musicals and actual theaters, other than them, um, people do still have many ways to entertain themselves.
That's good to know. That's even good to know for people here who are staying at home and need a little something to watch. So I loved something that you sent to me, and it wasn't very long ago, maybe a week ago. You had said, hang in there, it will pass and things will get back to normal. Is that what you guys are experiencing now?
I think normal is gonna be a little bit different now. It won't be back to normal, but yes, we're going back to business. I think the most, unfortunately, travel and theater businesses will still suffer for a while, but otherwise, on a regular basis, people are getting back to normal, and it will definitely pass. Just take care of your personal hygiene. Just take care of your health. Just be aware of your surrounding, and I think that's all you can do. And it will definitely. I mean, even look at Italy and Spain. Everything has been, going
Starting
down
to
or
flatten a
settling
bit.
down now.
Yeah, yeah. Thank you. Yeah, so there's a little bit of light at the end of the tunnel, some hope.
Definitely.
Good. Okay, great to hear. Well, thank you so much for spending some time with us, giving us some of your insight, telling us what you guys did over there. Always good to talk to you, obviously.
Always good to talk to you too, Patty.
And we'll catch up soon, I'm sure. Love you.
Okay, love you.
Thank you.
Bye.
Bye.